Hello and welcome to my YouTube channel again. This is Dr. Ash, and today is a Sunday, and I hope you guys are having a wonderful day today, enjoying your Ramadan days, fasting and relaxing. So, today I'm going to talk about a very interesting topic, very important topic as well, which is about a CV. How to write a very good CV, especially for the medical doctors. Now, before I talk about this topic, I would like to give you a brief introduction so that you can understand what's my job role and why I am talking about this. Am I the right person to talk about it? So that you can have an idea. So those who don't know me, for them, it's just a brief introduction that I work as an emergency medicine and acute medicine consultant in London, NHS UK, for last 5 years now, and I'm actively involved in teaching and training. I've trained more than 5,000 international medical graduates in NHS. I'm a tutor for PLAB, FRChem, MRCP, MRChem, and I'm also a part of the National Recruitment Training Program, and I act as an interview panelist for Emergency Medicine Training Program of the UK. So this video is all about how do you prepare yourself for the interview. It's not basically I'm going to talk about how to deal the interview. It's just how to how to make yourself presentable so that you get shortlisted for the interview. And of course, the CV plays the main role in that. So I'll just give you a brief idea about why I felt that we should do a talk on this topic, because as I already said, that I work and I trained and I teach doctors. So as soon as I teach doctors, and when they pass, they of course apply for the job. So some of the doctors, they don't get a job for a year, 6 months, and they just struggle. They said that, Dr. Ash, I have passed the exam, I qualified, I am GMC registered, I've got a license to practice, I've got a degree. I'm not sure why I'm not getting the interview calls. So because as a mentor, as a teacher, as a tutor, I just don't teach and just leave them. I will still follow them up after their exam success to see where they are standing. So sometimes I ask them to just email me their CV to find out what's wrong with that, and you would be surprised that when I read their CV, to be honest, it's shocking. It's like it's full of mistakes. There are grammatical mistakes. There are so many things which are contradictory. I wouldn't say they are a lie, but there's so many things which are contradictory. And of course, when you have these kind of errors in your CV, it's very, very hard to get shortlisted. And most of the time, people don't know why they don't get shortlisted. So I go and sit with them, and I just talk to them on Skype and say, look, this is what you have done wrong. This is what. Sometimes I spend hours and hours to correct their CV. Having said that, because this has been a consistent problem, this has been happening so many times, I think it's a good time to guide you about how to write the CV and what will make employer more attractive towards you, and what will be your selling point. How are you going to sell yourself that you are the right person? Because hundreds and thousands of CVs are now coming to us for few posts. So, and let me tell you that all CVs don't come to consultants. So there are few CVs which just get filtered by the HR and nursing staff as well, because as soon as they see that this guy is not meeting the essential criteria, and the language is just there are mistakes, there are so many contradictory things. So usually they don't get filtered towards us. We get only few which are actually a proper CVs, and then we select few. So let's talk about go through your CV and you check my points how to make your CV, and then you can correct yourself now. So passing an exam is not going to just help. You need to have a very good understanding about how to write a CV and what are the main points you need to highlight. So don't be scared about writing a long CV. Don't be scared about it. People think, the more precise your CV is, more it is good. Yes, to some extent it's okay, but you're applying for an overseas organization, you're applying for an overseas firm, where people don't know what is Dow Medical College, where people don't know what is Buckeye Medical University. So in that case, you have to explain a little bit that what was. I'll come to that point. So my CV is more than 17 pages, and which is like I write, if I try to keep it concise, but if I write everything, it will go more than 40 pages. But having said that, if I say someone my CV is 17 pages, then they get shocked, and then when I forward that CV to them, then they think, oh wow, then they replicate, they copy, and then they apply for the jobs. So now coming to my point again, what you should put in your CV. So common errors what you make. Number one, when you apply your CV, start your CV, of course on the first page you write your personal details, isn't it? So you don't have to put your date of birth, your address, your postcode. You just put your name, your email, your contact details, phone number, Skype ID, and I prefer to put a small picture on that, which also gives us a bit of idea about what is the candidate. So you can make a bit of picture about who are you going to interview. It's very useful. So personal details should be very simple, where you can put your PM, your registrations numbers, your GMC, PMDC, your license, practice number. That is sufficient. Don't put more than that. Then comes personal statement, and this is really very important. Personal statement. This is the main point where you're going to sell yourself, how you are going to be useful for this organization, how you are going to be productive, what's your standing. So number of time when we read the personal statements, we clearly understand that this is a copy paste personal statement. This is not actually the real personal statement, because the wordings, if you see that the wordings they use in the personal statement is a very hi-fi level of English. And when you read the real real CV, you will compare and you will say, okay, the personal statement was a very, very difficult or hi-fi English was used, grammatical mistakes, there were nothing there. But as soon as you go down and when you read the real CV, you know that this was actually the copy-paste personal statement. So please don't do that. I still remember that in Pakistan, I don't know in other countries, but I'm sure in many other countries it's the same practice, where people just go to the computer shop and they ask the people, yeah, can you make one CV for us? And they bring the CV and you just put your name and details and then you forward. Number of times people just make a CV night before when we ask them, can you please send your CV? And then they ask, oh, what do I need to write in the CV? So we people are very good, especially the doctors, they're very good at studying books, preparing vivas, exams. We are very good at that. But when it comes to sell yourself, when it comes to talk about your achievements, when it comes to show yourself in the CV, we are very, very bad at that. Literally, I'm telling you, I've got piles of CV. My email is full of that, and I can actually share with anonymously. I can share it with you that look, you will see that these are not a doctor CVs. So personal statement is a very, very interesting and important. So try to make it simple, and it should actually reflect yourself. So you can say, look, I am this. I graduated in this year, and I did those things. This is what my aim. This is what I wish to do, and this is how I'm looking myself forward in next 5 years, 4 years. So a small personal statement with a brief introduction. What's your background? And why you're applying for this job. Please don't use those dedicated, passionate. These things actually are going against your. The research has shown that when the person says, I'm very passionate about it, I'm very dedicated about it, actually they are not. So be very careful when you're using those terms. So this is about personal statement. Now the second heading is usually I would say you put your academic qualifications. It's very important. What are your academic qualifications? If you are PLAB, if you are GMC registered, if you are FCPS 1, 2, whatever exams you have done, just jot them down. So this is how you will go further. And there are two ways actually people start from the current to backward, like whatever the current status is, then they move backward. And some people they write down from when they started their career and how they're progressing. So I want you to start as, what you're doing currently, what's your current status. So put that first, so that we get interest, we get interest in your CV and we read about it. What's its current status? Now, so your academic qualification should go first. Now, after that, the next page, you talk about your professional experience relevant to the job, relevant to the jobs you are applied for. You start writing your all experience from the current job backward till the house job, till the first internship, apprenticeship you did, go backward. And don't just write 1 year, 6 months in surgery, 6 months in medicine. Well, it's good, but better to write a little bit more detail. In surgery, what was your rotations? Which department was that? So hospital, title, your title, months, duration, and then write about the hospital. So I always say, like, when I've worked in Dow Medical or Civil University, Civil Hospital Karachi, Bakai University, Medical University, but London, everyone doesn't know about that. So I can't just say, oh, I worked in this hospital and I worked this. So we have to give a little bit of introduction about that hospital as well, that this is one of the tertiary hospital, of the biggest hospital of the Karachi and in my city, and we see hundreds of patients. This is the 700 bedded, supported by very well staffed tertiary care hospital where we had neurosurgical facilities, a 2-3 line. And how was your experience there? What did you learn there? So I'll tell about myself that when I wrote in my CV about any particular hospital, I try to write a special thing I learned there. So in Royal London, when I write about my Royal London Hospital, I say I learned a trauma experience there. When I talk about my St. Thomas Hospital, I say, well, it's a wonderful department. I did my PEDS, emergency medicine, ITU, intensive care, and toxicology there, and this is what I learned there. So this is how you go backward, so that your CV get expanded, and the person who is reading, who gets an idea about you, that the person I'm recruiting, he got enough experience to actually join us. So this is how you go and write your practical experience, clinical experience, or professional experience. Now, you talked about personal experience, personal details. You talked about the personal statement. You talked about academic qualifications. You talked about your professional experience. Now it's the time to write about clinical competencies. Now this is the place where people usually get caught. Why? The CVs I saw for FY2 doctors, SHO doctors, the clinical competencies, they were writing everything which was not up to their level. The FI2 is writing, oh, I'm competent enough to independently do intubations, I'm competent enough to do chest drain, I've done lumbar punctures, this. Please, in UK, whatever you write in your CV is actually taken as a truth. Whatever you've written is a legal document. So you can't say, I've done difficult intubation, I've done this, intubations, I've done lumbar punctures, because in UK, they don't do it. The FI2s, the SHOs, they don't do that stuff until and unless they've been signed off by and supervised for a long time. So I saw a CV of a guy who wrote so many unusual things. I said, look, even a consultant will think 100 times about writing a difficult intubation. How come you have written that? So, and they said that we have worked as a GP, and then they write all the procedures. Well, the GP doesn't do procedures in UK the way they write all those things. So be honest. Don't write anything which you haven't done. Don't write anything which is not done in UK. Maybe you have done as a GP circumcision in your practice with someone, but if you write this in your CV, you will be in a big trouble. So avoid that. Now, so you wrote about your professional experience. Now the clinical competencies. So if you're applying for a junior job, please try to write something which is relevant to them. That I'm very competent in taking a history, examinations, making a differential diagnosis, formulating initial plan. I'm a great team player. I can, so something which is relevant to you, rather than writing a long list. Then you can write about the practical competencies, practical procedures. Don't write too much here. Just say, I'm quite competent enough to supply an oxygen, set up an IV drip, IV access, cannulations, drips, maybe simple procedures, but say limited exposure, but I can do with supervision. So this is the way NG tube or catheterization. There's something which an FI2 or SHO does in UK. Don't write hi-fi procedures. We don't like that, and we get usually scared from that patient, that doctor, that if he comes to our department, he's just going to do an unnecessary intervention or unsafe procedure. So this is one point. Now, once you've written about the clinical competencies, practical procedure, now it's important to highlight about if you've done any teaching. Very important point. And as a doctor, I'm sure, even if we haven't done any official teaching, but check yourself, think retrospectively. In 5 years, you must have done some teaching, some presentations, something. So just fill that bit that you love to do a teaching. If you're given an opportunity, you will be able to take a role. You used to teach final year students, undergrads, medical students. You used to be a simulator or something, but don't just leave that column blank. So teaching is very, very heavily weighted in United Kingdom. This is one point. Now coming to your hobbies, very important. The next point, you should write about your hobbies. What are your hobbies? Be very careful in that. I still remember we interviewed one doctor. He said, my hobby is, and this was an online interview, and this was the lead consultant asked, what are your hobbies? He said, my hobbies are watching telly, current affairs, political, and all those things. Okay, so because the whole team was sitting there, one of the consultants asked him, at that time Trump was elected, so he just asked him, what are your views about Trump, and what do you think? Is he going to be good or bad for the world? So on the other side, the candidate, he gave a very extreme answer, and we were just shocked. So the extreme answer that he's not good, he's bad, he's this and that, and he's going to ruin the world, and so many statements he said, but this actually put everyone off, that he's giving such an extreme answer. So keep your interview at a very light mode. When you're talking about hobbies, be sensible. Say, if you're doing writing about cricket, football, just know a little bit that they may ask you, okay, what position you played, what's your role. So a little bit of idea about, rather than just saying that, oh, I watched this or I do XYZ stuff. So have a little bit of idea about it. Now, if you have any research audits, just write that. And if you haven't had it, just fill that column in a way that you would love to do audit, or you were part of the audit, you were part of the research. If you get a chance, you will be able to do it, but you haven't done it at the moment. If you don't have research and audit, just leave that blank. Don't write anything. So we talked about personal statement, personal details. We talked about your academic qualifications. We talked about your clinical competencies. We talked about your practical procedure, teaching, hobbies, and the other important thing to include is your courses. So very important, related to your job. So I have done ALS, ATLS, APLS, or attended the conference, seminar, ECG workshop. So list of jobs you should write on. So this is what I would say that will attract your employer towards you. Don't write anything which is not correct. Don't write anything which is not relevant to your job. Do not just assume. Do not copy someone else's CV. For every job, try to make another CV. Spend some good long time on it. And now the last most important part is, whenever you're writing all those stuff, make sure that you do not make any grammatical errors. All right, this is really very important. We are reading the sentence, and all of a sudden the sentence meaning changes. So I would say that number of times those errors, those CVs with the full of grammatical mistakes, they are usually not forwarded further. So even the secretaries or HR, when they read their CV, they say, look, this CV is just crap. Even forwarding it to a consultant, the consultant would get upset. So I've seen so many CVs full of grammatical errors, and full of inappropriate information, inaccurate information. And the last part of the CV is make sure that you put the references on. Don't just say references will be available on request. No, we want a confident doctor who says this is my place and this is what my referee is. Most of the time we know that if the candidate has applied for someone and if he is MRCP, FRCP, and there's a strong reference, we prefer that rather than if someone says, oh, references would be given on request. So I hope this was very useful, and I will bring more stuff for you. If you like this video, please share it, subscribe my channel, and share it with your colleagues. Dr. Ash, consultant, emergency medicine, acute medicine from London. Thank you very much. I will see you soon with my another video. Wish you best of luck. Have a happy Ramadan. Jazakallah. Thank you very much.